it is recommended that the couples try to get pregnant when the woman is at least less than 30 years of age. For a woman with regular periods, you can calculate what a fertile window is. So when you know the date of ovulation, you can predict your fertile window and increase the chances of your pregnancy. Having a healthy lifestyle and being active is also very important when you're trying to get pregnant. Good morning, greetings from the New Medical Center. I am Dr. Nithya, consultant in Obstetrics and Gynecology at NMC. So today in this video, I'll be talking about infertility, the basic aspects of it, and how we go about evaluating a couple who approach to us with infertility. So in recent days, we see that the incidence of infertility is constantly rising. Though the world incidence quoted is only 10 to 15%, in practice, we see many couples are walking into the infertility clinic these days. So there are many reasons quoted for this. One of the important reasons being increased age of the female and the male partner when they are trying to get pregnant. So this age and fertility have a direct clear-cut relationship, especially for women. So as the age increases, we see that the quality and the quantity of the oocyte or the egg constantly decreases. So this has an effect or an impact on their fertility when they try to get pregnant. And also, as the age is more than 30 years, the egg production keeps decreasing. This is not true in case of a male, where the fertility status does not seem to decline with age. So because of this factor, it is recommended that the couples try to get pregnant when the woman is at least less than 30 years of age or maximum below 35 years of age. And the second factor that we see in the recent times is the lifestyle modification and the dietary changes that have led to a constant rise in obesity. So we know that obesity has a direct relationship on the hormonal balance, and this also can lead to infertility. So having a healthy lifestyle and being active is also very important when you're trying to get pregnant. So let us first see what is infertility and understand when we call them to be subfertile. So if a couple are trying to achieve a pregnancy for more than 12 months after having regular intercourse without the use of any contraception and they are not able to achieve a pregnancy, then we call them to be subfertile. So when they come to us, the first thing that we tell them is about the fertile window. So many of them do not have an idea of what a fertile window is. So let me try to educate a little bit on that. So fertile window is nothing but the days of the cycle when there is a maximum chance of pregnancy when they have intercourse. So next, how do we calculate this fertile window? So it is important to know that only for a woman with regular periods, you can calculate what a fertile window is. So when you can say that you are having a regular periods. So normally a woman is supposed to get her periods or a menstrual cycle once in 28 to 35 days. So anywhere between once in 28 to 35 days is normal. So when you are having a cycle, for example, say once in 28 days, you have to subtract 14 days from that to know approximately when you are ovulating. Ovulating is nothing but release of egg. So the date of ovulation is important because only 2 days before that to 2 days after that is your maximum fertility period. So when you know the date of ovulation, you can predict your fertile window and increase the chances of your pregnancy. So for a woman with a longer cycle, for example, say 34 days, again the date of ovulation will be on day 20. So depending upon this, you can predict your fertile period and try to have a timed intercourse during that period. So this is important to know. After knowing your fertile window, you can try for a normal conception for at least 3 to 6 months. So if this is very complicated and hectic for you to calculate yourself, there are a lot of apps that do it for you. So you can download one of them and predict the date of your ovulation. Similarly, after trying timed intercourse, if you are not able to achieve a pregnancy, then you need to have a medical assistance. So that's when you need to approach us for evaluation of the basic investigations in both female and male. So what the doctor does basically is, for the male, we do a semen analysis to see if the count of the semen is normal and also if the motility of the sperm looks normal. Also, we test if the sperms are normal looking or they have any abnormal forms. Similarly, for the female, what we test is the test for ovulation, whether you are releasing the egg at the right time and also appropriately. Second, we also test the fallopian tubes, which are important for picking up the egg, and also that is where fertilization happens. So we need to see if there is any block in the fallopian tube or if they are patent. Next, we check the uterine lining, whether it is favorable for implantation of the baby or is there any other factor that is disturbing the implantation of the baby. So these are the basic things that we evaluate when you come to us. Of course, this is not a blanket therapy. The treatment protocol varies from simple counseling about the fertile window till the next step will be to give some drugs for you to achieve the release of egg. They are called as ovulation induction drugs. Third, if you are not able to achieve, we will add some more injections, that is hormonal injections, to increase the growth of eggs. So apart from these, there are also other treatments like IUI, IVF and ICSI, which we rarely go when there are other indications. So this treatment protocol is usually not same for everybody. So this is a blanket therapy and I have only outlined the general protocol for infertility evaluation. You can also approach us for individualized treatment based on your needs. Thank you for your patient listening.